Hey, this is Dr. Tresser. Welcome to the Raising Healthy Kids workshop. You will have insight by the time we're done on how you can keep your child or your children healthy without drugs, without antibiotics, without vaccines, why we're in such a state of health crisis in America, and how to avoid it. I have 5 children. I have 4 grandchildren, one on the way. I wanted to have the healthiest kids, and I didn't like the medication, and I succeeded because of the principles I live by and the education that I applied. It was absolutely incredible, and I want to share that with you. What is incredible is you take a ovary and a sperm, and it creates a baby. And years later, it creates such diversity in our makeup with kids. It's just absolutely incredible. This power, this intelligence that creates the baby is within us. This intelligence is within us to keep us well for a lifetime. When we look at the brain and spinal cord development, the brain development is a protracted process that begins about 2 weeks after conception and continues into young adulthood 20 years later. This brain and spinal cord are the most important things for development and to regulate and keep healthy. And well, I'm going to show you that. The environment plays a role. The lack of nutrition like folic acid or the presence of toxins like alcohol can be both deleterious, which is harmful, influencing the developing brain. Vaccines, medications, food, environment, can they cause damage? And you'll tend to hear there are certain medications that a pregnant woman can take that are safe. Everything passes through the placenta barrier. When they did a test of chemicals in a newborn umbilical cord, they found 287 chemicals in this umbilical cord. This is before a baby even puts the first piece of food in its mouth or takes the first vaccine or drug. Already has 287 chemicals in the umbilical cord. 180 of those can cause cancer in humans or animals. 217 toxic to the brain and nervous system. And 208 can cause birth defects or abnormal development in animal tests. So we have to wonder, like, wow, before the baby's even born, this happens. So we have to look at you, mom. If you're a mom, what are you doing or what did you do and what are you around in your environment that could be setting this up? So this is very important. So the central nervous system, the brain is the computer. The spinal cord is connected to the brain to transfer the energy and the information to the entire body. It does that through the spinal nerves, connecting all the organs, hormones, muscles, glands. You have to understand everything in your body is connected to the nervous system. What is responsible for movement? Well, that would be our nerves. If we stand up, sit down, move our arms and legs, the nerves connected to the spinal cord to the brain is making the body move. But what about digestion, food absorption, the bladder emptying or bowel movements, breathing, heart rate? Do you have to think about breathing and heart rate? Of course not. This is automatic through the nervous system. What about healing? It's all set up and connected to the nervous system. That's why the spine and alignment is so critical, to have a 100% alignment, to have 100% function to all the organs, glands, muscles, and tissue. And even the brain gets information from the pumping of the cerebral spinal fluid into the brain, nourishing it. We'll cover that later. This is the only system, the brain and spinal cord, that's encased by bone. Why did God encase it by bone? Because it's the most important. Of course, it's there for protection, and it keeps our posture, and it keeps us upright. Now, we look at cell replication. Did you know that over 330 billion cells are replaced daily? And within 14 months, all your organs have been replaced. So your body's in a constant state of regenerating. You have to understand, cells continue to die off. So 330 billion cells die every day. 330 billion cells are made every day. How are they made? They're made by the nerve system, the brain and spinal cord, and the tissue. The tissue gets its information from the brain and spinal cord, and it supplies healthy tissue by the environment, by what you eat, your thoughts. Do you drink water or do you drink Diet Coke? you put chemicals in? Do you take vaccines and drugs? Do you eat Snicker bars? Those all have an influence on how cells make up the organs. And within 7 to 10 years, your entire body, the cells have been replaced. Food will be your building blocks of new cells. Like I just said, with Snicker bars or candy or protein, the healthier you eat, the healthier your cells are making the healthy organs. The environment, drugs, toxins, vaccines, the air, the pollution, the sunlight, these all play a role. So you have to look at everything you're doing in life, try to maximize the health and healthy lifestyle choices. The nerve system orchestrates all of this. So it takes the foods and it digests them and turns them into living tissue. It tries to process and detoxify against the drugs, the toxins, the vaccines, the air pollution, things like that, and rid it so it doesn't get stored in the body. But it can only do so much. We look at when masks came out with COVID, we would mask up to avoid a virus. We'd pull our mask down or we'd feed this to our kids, junk food, which is pollution, which is poison. And what a conflict. You have to ask yourself, why are we so scared about one virus when our kids aren't dying from COVID? They're dying from junk food, poisoning ourselves, the diseases that accumulate with these. So then we look at alignment. When does our spine first go out of alignment? This is a C-section birth. Most of the time they grab the baby by the head and pull on it. That is the first subluxation. That's the first misalignment to the neck. A baby cannot tolerate that. When that pulling, or they put a suction cup, a bag on its head, forceps and all this stuff, that pulling and twisting causes suboccipital strain. Where the skull meets the spine, that gets strained, that gets pulled apart. Dr. Gutmann, a German medical doctor, said that 80%, he investigated about 1,000 babies at birth, 80% had cervical strain at birth. That's a subluxation, that's a misalignment. Dr. Taubman, an MD at Harvard, related neck strain, subluxation, to sudden infant death syndrome. We look at sudden infant death syndrome. Of 2,605 infant deaths reported by VAERS, Vaccine Adverse Event Reporting System, from 1990 to 2019, 50% of sudden infant death cases were within 3 days post-vaccination. 78.3% occurred within a 7-day occurrence after post-vaccination, confirming that infant deaths tend to occur in temporal proximity to vaccine administration. Coincidence or not? This is you. You can decide on this. This is not coincidence when I look at this. This is a strong fact that this has a possible play on sudden infant death. Maybe not everything, but man, that is a powerful, high statistic. This comes from this resource, the NCBI. You can click that and go to it and you'll see the whole report. Heiner Biderman, an MD from Germany, also found that minor birth trauma can lead to headaches, postural problems, sleep disorders, unable to concentrate by 5 or 6. Manual manipulation, which is the adjustment, is best and should be done with x-rays. That's Dr. Biderman's response to that. So when we see the forceps, the suction, those things can irritate. So when I was in school, this is me in school, I think this was after a rugby match and I was holding my daughter Emily. When I had her, I wanted to make sure she didn't have the life that I had or my wife had, which was full of medications and sickness and chronic sickness. My wife was asthmatic for 23 years, taking medication nearly daily. And we didn't want that for our children. So I studied pediatrics. I studied how to realign these children and keep them in alignment. Here's a baby that was only about 4.5 pounds. The parents were patients and they brought their baby in, a few days old, to get checked to make sure that didn't have birth trauma, was aligned properly. This is done so gently that they would have their baby started healthy from birth with healthy nerve system, brain, and spinal cord. But here's a situation where this little boy, Colton, he was 2.5 years old. He was delivered by suction, and this was his x-ray. Reason I took his x-ray, he was 2.5 years old and was given 2 years to live. He went to Johns Hopkins, had all these tests done. His skin was so raw and sick, he would scratch every day. Uh, Luann, his mother, had to sleep. She had to sleep on Luann's chest at night with long sleeves and long pants because he would scratch himself until he was bloody by morning. So she would have to hold him every night to keep him from scratching. They didn't know what it was. They thought it might be vaccine damage. He was toxic. So they went to Dr. Patricia Kane at Johns Hopkins, leading specialist in toxicity, and she gave the diagnosis of unknown. We don't know why he's this sick. Keep giving him the steroids and the drugs that seem to calm it down. Obviously, it didn't correct it, because every time he got off the drugs, it would come back in full blown rash and sickness. He could only eat three foods: sweet potato, chicken, and green beans. So she said, if he doesn't get healed, if his body doesn't heal itself, which we have no idea why, he'll probably die in about 2 years because his kidneys are shutting down and he's developing bone tumors. And I have up there what's wrong with the x-ray. It should have a curve like that. There should be a bend to it. So the suction, any kind of trauma, any kind of pulling, physical manual pulling, suction, forceps, can straighten out the neck. His neck was completely straight. There was no curve, 100% loss, brainstem pressure. So we started to adjust him. And I knew he was allergic to everything. Vitamins wasn't working. They tried everything. They didn't try corrective chiropractic. So we started adjusting him. And in 3 months, he got his curve back. He had about 70% of his curve. That is fine. For a child, that is a perfect curve. And that was restored within 3 months. At that point, Luann started to cry and say, well, what do we do now? Because this is the first time in his life that he's stable without medications, but his skin was still damaged. It was raw. I said, we just have to keep him like this. We could adjust less often, but we had to keep him with this curve. And within about 2 more months, Colton completely healed. This is him at age 10 when he was in 4th grade and he was on the honors. And Colton is in his 20s now and completely healthy. And Luann posted on one of my Facebook pages when I would mention Colton's story that this saved his life. Chiropractic saved his life, and she has her son. Here's another child, Brennan. He came in, he had chronic ear infections. So that top bone where the red arrow is, that bone should be angled up like it is on the right with upwards, like the green arrow. That top bone, the atlas, affects the brainstem, the cranial nerves, eyes, ears, nose, and throat, sinuses, allergies, tonsils, ear infections. And we started to adjust him. Within a few months, his second x-ray, he had a nice curve. His atlas came up, and his ear infections were completely gone. Once you restore the alignment, take the pressure off the nerve system, the body can heal. The powers in the nerves. It's the power. It's the light switches. When we turn the light switches on, when we realign the spine, the power goes back into the body and it heals itself. Here's a boy. This is quite interesting. At age 11, he was a patient, and he had a 28-degree curve. Very nice curve in his neck. He did not like getting adjusted. He didn't like coming into the office. He complained to come in, so his parents just left him at home. He did video games. He played soccer. And he does all the tech stuff with his phone and video games and so forth, and obviously the computer and stuff because of school. So from age 11 to 17, 6-year time, he completely lost his curve and it went backwards, -5 degrees. He only got adjusted 3 to 5 times a year at best because he just didn't like it. Now he's in a crisis. Our children are on the computer, on the tech, on the iPads, on their phones, 8 to 10 plus hours a day. This is going to destroy the curve in their neck. We have to do things to positively affect the curve. And some of those things can be postural at home, just not letting them stare at their phone and getting good chiropractic care. So what generates the most powerful healing? Well, it's the brain. And Dr. Speary, he was a psychologist and a neurobiologist. Smart guy. He won the 1981 Nobel Prize he found that 90% of stimulation and nutrition to the brain is generated by movement of the spine. So this is spinal alignment. If the spinal alignment is moving properly, it's pumping the cerebral spinal fluid, the nourishment to the brain. And if we don't have that, we're going to start developing chronic sickness and disease. And later on in life, things like Alzheimer's, Parkinson's, and all disease can be related back to the brain. So we talk about symptoms, good or bad. Most of us will say bad. We hate seeing our kids sick. Even myself, I hated seeing my kid when they had a fever or throwing up. But I knew it served a purpose, like a fever. When a child has a fever, infectious fever increases gamma delta T cells that defends against cancer. You can only get this when a fever goes over 102 degrees. So a fever is a good thing. Treating a fever, if you pull the fever down, the child keeps getting sick because when the fever goes down, the bacteria and the virus thrive. The fever is there to kill off the disease. So a fever greatly improves the immune system and destroys the bad cells. It's tough for us as parents to allow this, but it's the healthiest thing to do. Patricia Brennan studied the immune system. She was a medical doctor, and she found that spinal manipulation, adjustments to the spine increased phagocytic cell respiratory burst. This is the white blood cells. You don't have to remember that. What this means is you get a 200% burst of your immune activity after an adjustment for up to 24 hours. So this is when patients call and they say, I'm not feeling good. We encourage them to come in. I don't get sick. My immune system's strong, to get the adjustment because it burst their activity, their cell activity, to help fight the disease and to fight the sickness. Gary Knoll, years ago, did a report called Death by Medicine. It's very hard to find on Google because they have pulled it down. You have to search it. This is the the highlights. Is he took all these medical treatment, medical system, adverse drug reactions, bed sores, infection, malnutrition, outpatient, unnecessary procedures, surgery-related deaths. How many deaths per year? And look at this. This is because they say right now medicine and our medical system is the third leading cause of death in Americans. Third leading cause of death. Gary Null reported that is by far the first leading cause of death. The cost of this is astronomical. So when you look at cancer and heart disease kills respectively about 500 to 600,000 people per year in the United States. We look at when we put these statistics together, nearly 1 million people die, far more than heart disease, far more than cancer. So what is more important? We need to be aware of our medical system, our medical treatment, and it's costing us $468 billion. One example is an ear infection. Over 5 million cases per year in the United States, 10 million annual antibiotic prescriptions, 30 million annual visits to the doctor. So if you take that 30 million and you times it by a $50 copay, 1,500,000,000, it's just ridiculous. This is insane. And years ago, back in the early 2000s, the number one treatment recommended, they did studies. It wasn't antibiotics. It wasn't fever-reducing medication, Tylenol, and that kind of stuff. It's so dangerous. It was osteopathic manipulative treatment, OMT. This stands for an adjustment. They didn't want to call it an adjustment. They wanted to keep it in their osteopathic medical world, so they used that term, and they actually put very specific guidelines. And when a child had an ear infection, they were not to be prescribed antibiotics for up to 3 to 6 months, that they were to try letting the child heal themselves and try osteopathic manipulative treatment. And then that just went by the wayside. Probably within 6 months, it was stopped being heard of and it was gone. Right now, 54% of our children have a chronic illness. That means asthma, chronic pain, motor problems, developmental, autism, learning disabilities, developmental delay, mental, depression, anxiety. These things are just going up every year. And it's a shame. These are our children. These aren't 80 and 90-year-olds that are at the end of their life. These are kids that are just starting their life. So we'll just go through this pretty quick. The depression anxiety medication side effects, it has a black box warning, which means it's very dangerous. Suicide. It can increase depression anxiety. Ritalin and cocaine both are stimulant to the central nervous system, and are both a Schedule II controlled substance. Isn't that interesting? So we're basically, when we're putting our kids on Ritalin, we're putting them on cocaine. Acid reflux. Acid reflux, Zantac was a common drug used. Well, they pulled it from the market. Why? Because it increases risk of cancer. Antibiotics, 70,000 ER visits a year because of antibiotics. It can destroy your gut bacteria from up to 6 to 12 months, which supports your immune system. Asthma medications, just look at all these side effects. I mean, this is insane that we're risking this just because we don't know what else to do. First, do no harm. That's the creed by the medical environment. I don't think they know that. They don't follow that. By far, they don't follow that at all. 50% of Americans are taking one prescription drug per month. 21% are taking 3 or more. 10% are taking 5 or more. Did you know that opioids killed 4 times more people than the Vietnam War? The CDC says that 50% of antibiotics are unnecessary and contribute to antibiotic-resistant bacteria. So how do you know if it's necessary? Well, first you should get some blood work and testing to see if it's a bacteria infection or a viral infection. Antibiotics don't work on viruses. You have to run their course. 70,000 children ER because of antibiotic medication. The most common diagnosis for kids is ADHD. ADHD drugs like Adderall and Ritalin are very dangerous. They can increase risk of heart attack, stroke, and seizures, and they can delay your growth of your child or delay puberty. FDA states that Ritalin's potential side effects, and I'm not going to read these. I'll just hit them. You can read them as you go through. You can see how crazy this is and why should we ever go down this path. There's other ways. There's other ways through nutrition, through homeopathic remedies, through vitamins, through eating healthy, through chiropractic, through exercise. Try everything before you put your son or daughter on this. So I hope this helps. I could include 50 more slides and continue to talk about this, but this gives you a foundation, grounding. Most important thing to do is avoid these psychiatric drugs, and the winning formula: get adjusted for life. Keep the spine and nerve system adjusted for life. Eat healthy. We have other workshops on that. Avoid medications at all costs. Do your very best. And exercise. Those are foundational things that if you stay by that, you're going to see high success with your child, and you'll never regret the time and effort you put into it.